Parkinson's disease can cause tremors, slowed movement, impaired posture and balance, and gait dysfunction. Now research shows augmented reality can help patients with these symptoms.
They can still see the entire environment, but they can also interact and see the digital environment. Similar to if you have a car, for example, with a windshield that can display the speed. That's augmented reality.
Dr. Jay Alberts is a biomedical engineer at Cleveland Clinic's Neurological Institute.
How can we use augmented reality to improve postural instability and gait dysfunction really was the focus of this study.
The key is helping a patient practice a cognitive task and a motor task at the same time.
You can actually improve their gait function, right? Because most of our activities when we're walking across the street, it's not purely motor. We're in Cleveland, you have to dodge some potholes, see is a car coming, can I make it across? So there's a cognitive component there as well. And so what we're trying to do with dual task therapy is to build both the cognitive and the motor component simultaneously.
Typically, this is done in physical therapy, which not every patient can access easily.
Where we are in Cleveland is not reality for most Parkinson's patients, right? We have great movement disorders neurologists here. If you go out to rural areas or underserved areas, it's very difficult to access a highly qualified movement disorders neurologist or a physical therapist who has experience treating Parkinson's. So our idea is exactly that we could potentially drop this into the home or drop this into other clinics in rural and underserved areas so they could be using the same type of beneficial technology.
Patients put on a headset and are asked to complete multiple tasks at the same time. For example, walking through a maze while being asked addition and subtraction questions.
We had 47 patients overall and split between the two groups, the traditional physical therapy group and the dual task augmented reality treatment group, or the DART, that used the technology. Both groups improved similarly, so good that physical therapy works and good that this new technology works as well. And so what we wanted to see there is that the technology was just as good as the physical therapy. We're just getting into more on the physical rehabilitation side and even aiding in the detection of disease through having a patient interact with digital objects or an environment. For example, one of the very early signs of neurological disease is a decline in what we call instrumental activities of daily living, such as cooking or shopping. We can start to build digital versions of a grocery store that a patient could interact with, and then we can precisely quantify their cognitive functioning as well as their motor functioning.
For Fox 8, I'm Dr. Mark.
Dr. Mark is sponsored by the Cleveland Clinic.